Chloe was a chef at a small restaurant famous for her spicy chicken wings that her customers couldn't get enough of. But one morning, she felt a burning, searing sensation in the skin of her left shoulder, as if hundreds of needles were constantly pricking her. She thought it was just fatigue from working hard, but only a few days later, red bumps began to appear and turned into painful blisters, making it impossible for her to lift her arm to chop vegetables or stand in the kitchen for long. What was worse, she followed a friend's advice to apply some herbal leaves to the painful skin, but the result was that her skin became irritated and infected, making the pain last longer. The restaurant had to temporarily close, and she was left in distress when she couldn't earn money to support her family. Chloe's story is not unique. Millions of people around the world, especially those over 50, are silently battling a disease called shingles. This disease is not only painful, but can also leave long-term consequences if not treated correctly. Today, we will delve deeper into understanding shingles. What is it? Why does it happen? And most importantly, how can you recognize and treat it in time to protect your health and the health of your loved ones? Let's begin our exploration together so no one has to suffer like Chloe. Shingles, also known as herpes zoster, is a viral disease with distinct symptoms such as severe burning pain, a red rash, and fluid-filled blisters on the skin. The culprit behind this disease is the varicella-zoster virus, a member of the herpes viridae family, and the same virus that causes chickenpox, which many people had as children. When you recover from chickenpox, the virus doesn't completely disappear. It hides in nerve cells, sometimes sleeping for decades, waiting for a time when your immune system is weakened from aging, stress, illness, or immunosuppressant medications to wake up and cause shingles. Key characteristics of shingles. Unique pain. Shingles is known for its burning, searing pain or a stabbing sensation like being cut by a knife. Many patients say the pain is even more severe than childbirth. It often occurs on one side of the body along a nerve pathway and has a clear boundary, not spreading to the other side. This pain may appear before you see any signs on your skin. Rash and blisters. A few days after the pain begins, red bumps will appear and develop into fluid-filled blisters. These blisters often appear in a cluster or a long band along a nerve pathway, looking circular or oval in shape. Initially, the blisters are firm and difficult to pop, but after a few days, they may shrink or break open from friction, which can leave scars or open sores on the skin. Other accompanying symptoms. In addition to the pain and rash, you may feel tired, have a low-grade fever, chills, or swollen lymph nodes in the affected area. Some people may also experience a one-sided headache or muscle weakness in the affected area, especially in older adults. The pain is often more severe in older adults than in children, who sometimes may only have a rash without pain. At-risk groups. According to research, 1 in 3 adults will have a chance of getting shingles in their lifetime. More than 90% of people over 50 have the varicella-zoster virus hidden in their bodies, and the risk of a recurrence is higher in those with a weakened immune system, such as patients with HIV, cancer, diabetes, or those taking immunosuppressant medications. Shingles is not only painful, but also poses a risk of serious complications if not treated correctly, such as chronic nerve pain, skin infections, or even blindness if shingles occurs near the eyes. Understanding the nature of this disease is the first step to recognizing and managing it in time to avoid the regrettable consequences that Chloe faced. Shingles isn't just a disease that causes temporary pain. If not detected and treated correctly, it can leave long-term consequences that have a serious impact on health and quality of life. Imagine having to live with nerve pain that lingers for months or even years, making every day a challenge. Understanding why shingles is a threat will help you take immediate action to protect yourself and your family. Impacts of shingles. Chronic pain. One of the most common complications of shingles is postherpetic neuralgia, which is chronic burning or stabbing pain in the area of skin that has already healed. This pain can last for months to years. This pain is not only uncomfortable, but also affects sleep, mood, and the ability to work. For someone like Chloe, who relies on manual labor, this pain can lead to loss of income and financial stress. Impact on overall health. Shingles often comes with fatigue, a low-grade fever, and general weakness, especially in older adults or those with chronic conditions such as diabetes, cancer, or HIV. In diabetic patients, the varicella-zoster virus can make blood sugar levels uncontrollable, leading to acute complications like diabetic ketoacidosis, which is a life-threatening condition. Risk of serious complications. Although rare, shingles can cause serious consequences, especially when it affects sensitive areas like the eyes, ears, or head. Shingles in the eye can lead to inflammation of the cornea, corneal scarring, or even blindness if shingles occurs near the eyes. Shingles in the head and neck area can cause meningitis syndrome, with symptoms like severe headache, neck stiffness, and nervous system abnormalities. In addition, recent research has also linked shingles to an increased risk of stroke and heart problems, especially in those with chronic conditions. Psychological and social impact. Long-lasting pain and blisters on the skin can make patients feel insecure, anxious, or socially isolated. Many patients, like Chloe, have to temporarily stop working, limit social activities, and face stress from not knowing how to manage the disease. Why take action immediately? Shingles is not a disease that heals on its own in all cases. While some young and healthy people may recover on their own, for older adults or those with a weakened immune system, delaying treatment can lead to irreversible consequences. Taking immediate action, from recognizing the symptoms to seeing a doctor, can help reduce the pain, shorten the duration of the illness, and prevent complications. Additionally, knowing about shingles can help you protect your loved ones, especially older family members who are at a higher risk. Now that you understand what shingles is and why it's dangerous, the next question is, how can you recognize and treat it effectively? Don't let yourself be in a situation like Chloe, who had to suffer from pain and complications simply due to a lack of information. Here's a step-by-step guide to help you recognize and manage shingles. Step 1. Recognize the symptoms early. The first signs, burning or stabbing pain on one side of the body, often along areas of the skin such as the back, chest, shoulder, or face. This pain may occur before you see any signs on your skin. Rash and blisters. A few days after the pain begins, a red rash will appear and develop into fluid-filled blisters. They often appear in a cluster or a long band along a nerve pathway. These blisters may be itchy, firm, and can break open from friction. General body symptoms: feeling tired, having a low-grade fever, chills, or swollen lymph nodes in the affected area. If you experience a one-sided headache, muscle weakness, or abnormal symptoms in your eyes or ears, be especially cautious, as it could be a sign of shingles in a dangerous area. Checklist. If you feel a burning pain on one side of your body, along with a rash or blisters, note the time the symptoms started and their severity. This information will help the doctor make a more accurate diagnosis. Step 2. See a doctor immediately if you suspect shingles. What to do? If you suspect you have shingles, see a doctor, especially at a clinic specializing in dermatology or infectious diseases. Do not self-treat with folk remedies, such as applying leaves, chewing green beans, or using unknown medications, as these methods may worsen the symptoms, such as causing a skin infection or delaying healing. Conditions. See a doctor within 72 hours of the symptoms first appearing, as this is the golden window for starting antiviral treatment, which will help reduce the severity and prevent complications. Checklist. The doctor will ask about your history of chickenpox, examine the affected skin area, and may perform additional tests if necessary to confirm that it is the varicella-zoster virus. Step 3. Treat correctly. Antiviral medication. The doctor may prescribe medications such as acyclovir, valacyclovir, or famciclovir to inhibit the growth of the virus. These medications are most effective when used within the first 72 hours of the rash appearing. Pain relief and skin care. To relieve pain, the doctor may prescribe pain relievers such as acetaminophen, ibuprofen, or in cases of severe pain, nerve pain medications like gabapentin. Caring for the affected skin can be done by gently washing it with saline solution or applying creams or ointments as prescribed by the doctor to prevent infection. Rest and health enhancement. Getting enough rest, eating a healthy diet, and avoiding stress will help the body recover faster. Avoid scratching or popping the blisters to prevent scars and infection. Checklist. Track the progress of the disease after 3 to 5 days of treatment. If the pain or rash does not decrease, return to the doctor for a reevaluation. Step 4. Avoid common mistakes. Do not self-treat. Avoid using methods without scientific evidence, such as applying leaves, using folk remedies, or using antibiotics arbitrarily, as these have no effect on the virus and can be harmful. Do not neglect the symptoms. Although shingles may sometimes heal on its own in young people, delaying treatment in older adults or those with chronic conditions can lead to serious complications. Checklist. If you have tried a folk remedy and the symptoms have worsened, for example, the skin has opened sores or the pain has increased, stop immediately and see a doctor. By recognizing the symptoms early and treating them correctly, you can shorten the duration of your suffering and reduce the risk of complications. Taking timely action not only helps you recover faster, but also protects your quality of life. Shingles is not just a painful disease, but also a warning about the importance of healthcare. From Chloe's story, we see that a lack of knowledge and incorrect actions can turn a life upside down. But with the information you have today, from recognizing the symptoms and treating them correctly to preventing them effectively, you have the tools in hand to protect yourself and your family. Don't let shingles steal the joy from your life. See a doctor early, get vaccinated if you are eligible, and share this knowledge with your loved ones. If you found this video helpful, please like, share, and subscribe to the channel so you don't miss out on other useful health information.